What to do in case of a sudden spike in blood pressure. Which medications can be taken and which ones must be strictly avoided to prevent serious consequences. When should you call an ambulance immediately instead of self-medicating? In this video, I'll explain what to do during a hypertensive crisis and how to lower blood pressure quickly and safely. Before we start, don't forget to subscribe to the channel, like the video, leave a comment, and share it with your loved ones, friends, and colleagues. It's important to understand, not every increase in blood pressure means a hypertensive crisis or even hypertension. The diagnosis of hypertension is made when blood pressure persistently exceeds 140/90 mm over a long period. Temporary spike can happen even in healthy individuals due to stress, lack of sleep, alcohol, or overexertion. Hypertension is one of the most common diseases in the world. In Russia, about 45% of the adult population suffers from it. But that figure only includes those who have been officially diagnosed. Many are unaware of their condition because hypertension often has no symptoms. Even among those diagnosed, only a portion take medication regularly, and not all do it effectively. Statistics show that only 40% of men and 50% of women take medication properly and achieve results. What happens if you don't treat hypertension? It leads directly to heart and kidney failure, heart attacks, strokes, arrhythmias, and dementia. Untreated hypertension is the leading cause of cognitive decline, not statins, as many mistakenly believe. Even in young people, hypertensive encephalopathy, brain damage caused by high blood pressure, can develop. This is just one reason why hypertension significantly increases the risk of disability and overall mortality. The main goal of treating hypertension is not just to lower the numbers, but to prevent severe outcomes: heart attack, stroke, heart and kidney failure. In other words, we're treating more than the numbers on a monitor. We're protecting life quality and longevity. Many people mistakenly believe that if high blood pressure doesn't cause symptoms, it doesn't need treatment. This is false. The body can adapt to high pressure, and a person may get used to readings like 180/200 mmHg until disaster strikes. The doctor's task is to find a therapy that keeps blood pressure within the target range consistently, not just knock it down during spikes. The ideal therapy provides stable 24-hour control of blood pressure. Important. There is no such thing as working pressure of 150 to 160 mmHg that is well tolerated. Statistics show that most heart attacks and strokes occur at these mild elevations. That's why 120/70 mmHg is considered safe, and ideally 1 to 10/70. These recommendations are supported by major clinical trials, particularly the SPRINT study, which demonstrated that patients whose blood pressure remained around 120/70 had significantly lower risks of heart attack, stroke, and death than those with 130/140 mmHg. Modern cardiology guidelines, including from the European and Russian societies, define 120/70 mmHg as the target blood pressure for the vast majority of patients. A hypertensive crisis was previously defined as a sharp increase above 180/120 mmHg. This may be a sign of a heart attack, stroke, pulmonary edema, aortic dissection, or kidney failure. In such cases, call emergency help right away. Self-treatment is not acceptable here. What if there are no symptoms? In most cases, increased pressure is uncomplicated and even asymptomatic. But even in such cases, you should not lower pressure sharply. Constant fluctuations in pressure, up and down, increase the risk of stroke and kidney damage. The main mistake is to lower pressure quickly and sharply, especially if done regularly. This tactic is dangerous and worsens the outlook. What should not be used to reduce pressure? Some medications are strictly unsuitable. Nitrates, nitroglycerin, nitrosorbide, nitrospray. Drop pressure rapidly, may cause fainting and even death. These are only for angina pain relief. Short-acting nifedipines, e.g. Cordaflex, Calcigard, phenididine, also drop pressure sharply and may be dangerous. What to use for elevated pressure? Recommended medications: captopril, capoten, physiotens, moxonidine. Important: do not dissolve under the tongue, as often advised. This can cause a sharp drop in pressure. Medicines must act gently and gradually. Why not lower? Blood pressure too fast? A sharp drop in arterial pressure can be worse than high pressure itself. The optimal approach is a slow, controlled decrease by 25–30% of the initial value over the first day. Example: if pressure rose to 200 mmHg, reduce it to 150–160, not straight to the ideal 120–80. Fast drops may lead to stroke, acute, kidney damage, ischemia of internal organs. Many patients wrongly believe drugs like moxonidine, captopril, or physiotens don't work because there's no instant result. But their slow action is what makes them safer. They gently lead pressure to target levels without spikes. What must not be done with high pressure? Taking several pills at once, lowering pressure to normal in 10–15 minutes. Using old generation drugs, clonidine, nitrates, e.g. nitroglycerin, nitrosorbide, short-acting nifedipines like Cordaflex, phenididine, etc. They may cause sudden drops, collapse, and even death. Who is especially at risk from rapid pressure drops? Elderly. People or their vessels are less elastic. Sudden pressure drops disrupt organ blood flow. People with carotid and brachiocephalic artery atherosclerosis may lead to brain ischemia. Smokers. They develop vascular aging and atherosclerosis even at a young age. What to do if pressure spikes often? If you often use emergency pressure drugs, your maintenance therapy is ineffective. You need not knock down pressure, but adjust your regular treatment plan with your doctor, cardiologist, therapist, neurologist. For all healthcare specialists, if high pressure is detected during a visit, do not ignore it. Even if the patient came for another issue, attention should be paid and further examination or cardiologist referral recommended. How to quickly lower blood pressure? Answer: you shouldn't. Popular question: how to lower BP in 2 minutes? Answer: never try to lower pressure sharply. It's dangerous and worsens prognosis. High pressure at doctor visits is often white coat syndrome, especially in the elderly. Up to 70% of older patients show elevated readings due to anxiety during medical exams. What to do in such cases? Let the patient calm down, e.g., sit in the hallway. Recheck in 10–15 minutes. If no symptoms and the patient feels fine, don't give medication just in case. Recommend calm home monitoring and follow up with a doctor for therapy. Assessment. Mistake number 1, quickly lowering pressure using fast-acting drugs. This leads to risk of fainting, brain and kidney ischemia, worsened overall prognosis. Constantly knocking down spikes is not the solution. It signals poor basic therapy. Regulation. Rapid pressure swings are especially risky for elderly people, for smokers with carotid artery atherosclerosis. Instead, adjust a daily treatment plan with your physician. Change lifestyle, quit smoking, cut salt, improve sleep, reduce stress, increase physical activity. Forget the idea of a magic pill for blood pressure. In the long run, this does more harm than good. Thanks for watching. If this was helpful, share with friends, family, colleagues. Leave comments, like or dislike. All feedback matters. Subscribe and take care of your health.